Hi, I'm Dr. Sumana Shivanand, consultant pediatric pulmonologist, allergist and sleep specialist practicing at Cloudnine Varthur branch, Bangalore. There is a lot of stigma and confusion about the use of steroid inhalers. So, in contrast to oral steroids, the inhalant steroids or corticosteroids or inhaled MDIs, which are used for child with asthma or a multi-triggered wheezing or a hyperactive airway disease, drug is acting locally and almost there is nil absorption into the blood, which would not give any side effects, and it's totally safe to use inhalers in children. A child has to be taught how to use the inhaler well because technique is as important as administering the drug. Child has to be taught how to breathe. In younger children, we use spacer with a mask, and in children above 5 years, we use just the spacer. So the child has to keep the mouthpiece in the mouth and make a tight seal with the lips and breathe through the inhaler 10 to 12 times. In younger children with mask, the child has to breathe for about 45 to 60 seconds with the mask on the face.